you have heard a wealth of information. And I'm sure those of you who are here and those who are following us online might be saying, well, we just wish Dr. Faith B. Israel was the actual Secretary of Health. And that will happen sometime soon, God's willing. But it also speaks to why we ought to have a functioning healthcare system.
Yeah.
Because diseases like the coronavirus and communicable diseases generally, if you look at global trends, it will appear as if every year or two something new is emerging.
Yeah.
And it means that if we are to be a successful society, we have to have systems in place. Regardless, if you look at territories like Australia, for example, immediately they were able to have scientists and doctors and experts working on it and looking at treatment plans. You know why? Because they have always had a system in place for anything that emerges.
Yeah.
And that's where we ought to be. But we cannot be at that place because one, we had a dysfunctional Secretary of Health. Two, we still have a dysfunctional TRHA board, and I am going to this morning call for the entire TRHA board to either be fired or for them to resign, because we cannot have a situation where we are changing CEOs more frequently than some people are changing their underwears. That is far too frequent.
Yeah.
And if it is, this board has been picking the wrong CEO so often that every Monday morning they must fire the CEO that they would have hired, it means that something is wrong with the board.
Yes.
And we are facing a collapse across the system. And so the entire TRHA board must pack their grips, pack their bags, and accompany the secretary out the doors because they are dysfunctional.
Yeah.
The healthcare system has not worked well for a very long time. And the TRHA board, which is a board of governors, must take credit for the dysfunction, must take credit for the failure because they have failed to fix the system. And it is sad that we have a relatively new hospital, but we have such prolonged old problems in terms of system malfunction. We shouldn't be talking about incinerator in 2020. We should not be talking about wards without air conditioning or with electrical problems. We should not have issues with whether or not the medical ward can remain open or not, and whether we have sufficient staffing and qualified staffing. These are issues that should have been handled by the TRHA board. Yeah. And quite frankly, the TRHA board is dysfunctional. Quite frankly, the TRHA board is an epic failure. And we have to face the issue frontally and treat it frontally.
Yes.
We cannot keep burying our heads in the sand. Because one day, it may not be the coronavirus, but it may be something greater than the coronavirus, and we are simply not prepared to handle anything. I mean, we're not even properly prepared to handle diabetes and hypertension, much more these diseases that are emerging year after year. And I could recall sometime last year saying in the House that if when we look at our numbers, our case numbers, and we are seeing gargantuan increases in the number of people seeking treatment at our medical facilities, then we have to say to ourselves that we are failing.
Yeah.
One sign of success is a reduction in the number of people actually getting sick. And if we are seeing increases and great increases year by year, it means that the healthcare system on the island is not working. And I'm not saying that to scare people away from seeking treatment at the hospital, because we all have to go there if we have to go there. But better can be done. Better can be done given the resources that we do have. And we can't be failing the system, failing the workers within the healthcare system, failing the patients, and ultimately putting the entire island at risk. It means all our other industries are also at risk. Because think of what will happen to the tourism sector if we have something major that we can't handle.
Yeah.
Think of what will happen to our productive sector, our young active workers. Think about what will happen to our seniors, our vulnerable. And so this is why we cannot seek to be politically correct when it comes to the healthcare sector. This is why I refuse to be polite when it comes to the healthcare sector.
Yeah.
Because this is a matter literally of life or death. That's what it is. And so we have to improve on our healthcare. I find it shocking that we would have had the resignation of the Secretary for Health, and at this point we have not had a replacement being announced.
Yes,
I mean, come on.
crazy.
And then as she resigned, the board decided to fire the CEO, and I'm wondering, but where is the executive council's administrative reach in all of this? Where are they taking? Where is with whom is the buck stopping? And then we know that we have a chief secretary on pre-retirement leave, more or less, and then we don't know who will become the mock chief secretary that Trinidad will install on PNM's behalf, and so the whole system is collapsing because we have allowed the internal ramblings of a party to destroy the spirit of the Representation of the People's Act, to destroy, quite frankly, the sanctity of the TRHA, and we have had outsiders, people not elected by Tobagonians, more or less sitting down and trying to drive the process and control and manage what happens at the Executive Council. And quite frankly, it destroys any credibility the PNM has when it comes to articulating a position for Tobago's autonomy, because clearly the Tobago PNM isn't even autonomous in its own rights.
Exactly.
It cannot even handle its own business. People could come from Trinidad and tell them what to do, when to do it, who to put where, who to take out, and it is affecting us and affecting the administration of this island. It is a breach of the TRHA Act. It is destroying the spirit, opinion, juris of the TRHA Act, and that must be something that has to be addressed.
Yeah.
It is time for us to settle down. This has been going on for far too long. We have almost a year again left. We're just shy of a year left. And so we can't continue like this for the remaining portions of the term. We have to get back to business quite quickly. And this is very disruptive. And Dr. Faith Israel quite pointedly, quite factually, quite maturely explored the challenges to the health sector at this point, and explore the challenges with COVID-19, and explore the reality that should we be hit with that COVID-19 or something more serious, we may very well be much ill prepared, simply because there is a breakdown in systems, starting with the Executive Council that is sick, all the way down. And so I am saying, TRHA board, pack your bags, because you are sickening. Time to go. Questions?
Charles, when responding to Dr. Carrington's position, praise of some of the initiatives to go to the health sector, and your comment thoughts on that?
Well, I don't know what you expected Mr. Charles to do. He appointed her. A fisherman never said that he fish rotten. But quietly, her performance
Speaks for itself.
stunk to the highest heavens. It was like group out of water. And so, thanks but no thanks. The 10 years come to an end. Thank you for the time you have spent there. But Tobago can do better. And we are waiting for better. And quite frankly, the PNM must take responsibility for the last 3 years and
The last 20 years.
well, last 20 years, and in recent times, for the 3 years of Dr. Carrington and what she brought to the table and what she did not bring to the table, we were not impressed with her performance. In fact, nobody was impressed with her performance. Nobody is impressed with the Executive Council performance. And so maybe they all should take a cue from Dr. Carrington and sign resignation letters and go.
Are you seeing any link between resignation of Dr. Carrington and the dismissal of the CEO of the TRHA?
I don't know if there is a link or if that's coincidence. It may very well be the lingering wish of Dr. Carrington, because we know how she micromanaged everything. So I wouldn't be surprised if the firing of the CEO was also a wish of the outgoing secretary. But we are saying the TRHA board, the CEO is gone, the secretary is gone, TRHA board follow suit.
Do you think that the task force has going to be engaged this evening would be effective to see what's going on with the health sector, what happened in the health sector in the last few years?
Dr. Faith, answer this one because I might not be polite.
I don't think so, because the reality is the task force was promised since November, and I think it was only actually set up in January because I asked a question to the chief secretary, when is the task force being set up? And because they knew they had to come to the house on Thursday, they called them together to start on the Tuesday before. I have no faith in that because I don't think it was done with the genuine objective of critically analyzing where we are and figuring out where we need to go in the health sector. And I have no positive views about it. Ideally, if people go out this afternoon and they express themselves as they have been expressing in every single consultation that the health sector has had for the last couple of years, we expect nothing to come out of it because nothing has come out of all of the complaints that were done over the last 3 years and certainly over the years before that. So I have no faith that it will renown to any real change in the system.
And I can tell you that the TRHA and the outgoing secretary or the former secretary, they have held community engagement meetings. And at those meetings, people were quite frank in expressing their lack of pleasure in how the healthcare system was operating. And nothing changed. The task force is just a sham. Nothing much is going to come out of it. And nothing real will come out of that. We don't expect any result. It's just to try to pacify people, try to make people not as angry as they are about the failing healthcare system. But that's as far as it is. And how it is, we are having this task force, and on the cusp of the task force, the secretary resigns, the CEO is fired, the TRHA board is behaving crazily. I mean, come on. Much wouldn't come out of that. But I'll be surprised if anything comes out of it that is significant. Sure. Well, I believe it was either a year or two ago, we brought a motion to the House asking the TRHA to sit and to look objectively, notwithstanding what the former Chief Secretary had placed on in the public domain about having a second carnival, to take a second look at it and to objectively assess whether or not Tobago needs a second carnival. That is yet to be done. And that has been our position. Our position has been we need to actually stop, assess it, see whether it's plausible, see whether it makes economic sense, see what impact it will have in terms of disruption on other services such as education sector in the island, and whether it is worth it, weigh the balances, look at the opportunity costs, for example, and then decide whether we should have a second carnival. But we cannot just sit by year after year whine about the fact that many Tobagonians, many foreigners choose to participate in carnival in Trinidad, because the reality is Trinidad has a bigger, much more exciting, much more offerings in terms of the carnival product, much more mature, much more developed carnival product than Tobago does. And no one in the Caribbean can compete with Trinidad's carnival, not even Tobago carnival. That's the reality. And we have to decide whether we are happy to play second string to Trinidad's carnival in the pre-Lenten season, or whether we want to have it at a later point where we may actually earn a lot more money from it. But it's something that we have to sit and objectively look at, analyze it before making a decision. So we can't just say willy-nilly, yes, have a second carnival, but we have to sit and objectively do the work, plan it out, work it, and then present it to the people. That's what needs to happen, and that has not been done.
But I would like to add, though, that looking at the offerings of the band leaders and looking at the offerings of the individuals who participate in carnival, so we have the mass, we have the pan, we have all of those things. I have actually been pretty impressed by the offerings of Tobagonians this year. The mass was really, really, really top quality mass. The pan was, of course, really, really top quality, which shows that Tobago can produce if we are managed properly to produce. Because even given the horrid management that happened over the last couple of weeks as it relates to Carnival in Tobago, those individuals who are the stakeholders were able to pull through, even though what happened at the TRHA level and what happened at the Festival Commission level and so forth seemed to be in shambles. They still were able to show up and show out, and I think they need to be commended for. They certainly need to be commended for that.
And while we are talking about the arts, or what is known as the orange economy, meaning what the creative sector can put into one's economy, it should not go unnoticed for us that we have not yet heard about Tobago Jazz, except for a singular letter or notice asking for auditions, I believe. And if the Jazz Festival was supposed, and I'm talking in past tense here, was supposed to happen in April, it means that we are just about a month or so away. And it should not pass on us that we have not yet seen the report that was done on the Tobago Jazz, because remember, we commissioned an analysis of the Jazz Festival to see if we are getting value for money, and to see the impact the festival is having on the local economy. We have not seen that report as yet, and it has been more than 2 years since that was commissioned. We have not gotten back our monies from D'Angelo, and no, I am not giving it up, and I will keep talking about the $430,000 US, because if I get $430,000 US to spend in my electoral district, trust me, the amount of things that can be done for people who need stuff to be done, they will be happy. So $430,000 US is a lot of money. So perchance they may be having just sometime this year, we don't know, because somebody thinks it contributes to the orange economy. But if they do, before they decide to advertise jazz, they need to present us all with that report, and they need to show us a copy of the check that we received as returned from D'Angelo. If they can't do that, then they should forget it. If they can do that, then we may be on our way to having just 2020. But at this point, we should pay attention to the fact that we have not heard sufficiently about that. And it also speaks to the larger picture of how we have been treating with the creative arts in Tobago, how we have been treating the creatives on the island, how we have been managing that sector of the island, that sector that we call culture, so frequently with such scant courtesy, with disrespect, how we have been not giving it our all, because we do have the potential to earn a lot from this sector, but we have not been doing the kinds of work that we should do in this sector. And that's something that is critical and that we need to pay attention to, because somebody going to wake up Friday and realize just come back again, and then while are we going to start seeing things on Facebook and elsewhere, and all of a sudden there'll be jazz and a rush promotion, and I don't know if that will attract the foreign investment and the foreign tourists that we need to attract to the festival. I don't know if that will give Trinis enough time to book the guest houses and to see about what they will do with the children and all of those things. So, I mean, what are we doing? Is it that the executive council is on go slow? I don't understand. It's as if everything has been paused.
Halted.
Everything has been halted. And that is significant. And all of that has happened because of one internal elections. I say it's time we pack up the whole team in a crocus bag and fling it away and start afresh, because that's what needs to happen with regards to Tobago. Man, they could have called that since 2 years ago. You know how long we moved a motion of no confidence in them? That was January 2018. We moved a motion of no confidence in the Chief Secretary. So all this bacchanal to get rid of the Chief Secretary now, we told them since 2018, clearly they are late on the draw, and clearly they're only doing all of this in hopes that they could regain favor with Tobagonians. But I thank God that Tobagonians don't have short memory, and I thank God that there's this thing called a good Tobagonian bad mind, and we will be holding on to that and going to the polls with a revolution in the mind, in our minds, come 2021 or whenever they decide to call it. Okay, thank you, members of the media. Thank you for being with us today. Hopefully you will have a press conference tomorrow, and hopefully they will introduce a new Secretary of Health to you all tomorrow. Hopefully something will happen there.